COVID-19, since its emergence, has proven to be the greatest challenges for the mankind and has been the biggest global health crisis. India, in the year 2020, not only faced a pandemic, but also witnessed an unprecedented socio-economic crisis, which has left its impact on 2021 as well. India now has reached a tragic milestone of more than 12.2 million cases and 1,62,000 deaths. While our frontline workers and COVID warriors continue to fight, we made sure that we stayed true to our mission and continued to provide credible and clinically sound information 24 by 7, just not only about COVID-19 updates, but now also about the COVID vaccination drive nationwide. You asked and we delivered. Yet again, on high demand from our clinician community, we are hosting an exclusive webinar on COVID-19 vaccinations through a doctor's lens. Today, we have with us Dr. Anirban Dalui. He is a public health expert. He's also currently associated with RG Kar Government Hospital as an assistant professor in the Department of Community Medicine. He's a part of COVID protocol monitoring team for the government of West Bengal and also chairs a lot of COVID advisory boards across several municipalities in West Bengal. Welcome, Dr. Anirban. It is a pleasure to have you with us today. We are looking forward to this much needed session to help our community get an overview of the nationwide vaccination drive, as well as the latest surge that has been resulting in a lot many COVID positive cases than we witnessed last year. But before we start, I would like to share some insights with all our viewers of a poll that we had conducted within our Docplexus community of doctors. And within the first 2 days of the poll being live, we had almost over 500 of our peers participating in the poll, wherein 56% of the respondents had received both the doses, 11% of the respondents had just received the first dose, and 33% were still planning to take the dose. The division between the preference of Covishield and Covaxin was clearly at 98% for Covishield and 2.41% for the Covaxin. Upon asking for their experiences with any adverse events or any contraindications or with any comorbidities that they had, the local pain attributed to almost 42.3%, myalgia to 32.6%, whereas headache, fever, and fatigue ranged between 15 to 25%. Out of which, 82% of the respondents also reported that they did not experience all the adverse events during both the doses. These are few of the thoughts that our doctors shared on the platform, wherein many of them think that we need to open more vaccination centers, more surveys like the one we conducted needed to be published, and there should be a campaign based on the behavioral change and communication that was much required. We continue to put this poll on our platform, and we urge all our peers to come and participate and help us gather insights and also join hands in encouraging more and more people to take the vaccine. What do you think, Dr. Anirban?
Yes, this is very much important, and the whole vaccination and the COVID situation is now alarming, and the vaccination is the only hope, I guess. I want to say further on it. And as you have mentioned about everything in detail regarding the current situation and what we're going to face and what we have right now with us and what is our current strategy to overcome this kind of alarming situation. So I'm going to send some slides, some kind of information with all of you so that the images will be more clearer for many of us.
We are looking forward to that, sir.
So, first of all, I would like to mention the current status of COVID-19, as already have mentioned by you also. The moderator is well prepared slides. And with the reference of that, I want to mention the total number of cured patients and total number of active cases and deaths. And if I consider the death rate of India, that is around 1.34% right now, and the top 10 districts which are mostly affected with the active cases with the maximum number of active cases like Pune, Mumbai, Nagpur, Thane, Nasik, Aurangabad. So Maharashtra is severely affected with Bengaluru, Delhi, like that, and Gujarat. So these are the six states with 79 to 80% of new cases reported from whole for the all over the Indian cases, and Maharashtra itself it takes around 31,643, and Punjab, Karnataka, Madhya Pradesh, Tamil Nadu, and Gujarat all are above 2,500 cases per day. So this is a good quality picture of the uh, respective states with their current number of just now, that is 31st March, the current number of cases and their the uh, graph of having this kind of new cases has been shown here. And these colors used to highlight the names of the states with 7-day moving average. That is 7-day total number of average has been taken as a variable, and this was put into the graph, and the graphical representation shows us some important but mischievous things like in Gujarat, in Maharashtra, you can see the second spikes are more intense, more steeper in cases of Maharashtra, Gujarat, etc. If I consider this, I am highlighting the points in Gujarat. The spikes is coming above Maharashtra. Again, the spikes are coming up, and also the other states like Madhya Pradesh, Chhattisgarh, Karnataka, Kerala. Kerala already have a second peak, but still they are having a good number of cases right now. This is a brief representation of the whole scenario state-wise, and you can see every time, every day in your news media or in your websites, etc. And government publishes this bulletin every day. So Maharashtra, you are again they are leading always in case of total number of cases, in case of active number of cases, in cases in respect of the death, everything. So Maharashtra, Kerala, Karnataka, Andhra Pradesh, Tamil Nadu, Delhi, the mostly affected states. Whereas the eastern and northeastern other states like Uttar Pradesh, like West Bengal, like Odisha, they are less likely to get involved, but there are very much chance to have this kind of second wave and infection, which I'm going to elaborate in next slides, next presentations. But the situation is alarming there because they will be having their elections and everything, the local gatherings there, everything is going on there. So what every doctors, every citizens of India has a question of second wave, and media is constantly highlighting the situation. This we are having the second wave. The Prime Minister has just mentioned this. India has experienced the second wave already, and it will get it peak very soon. So what is second wave? This is not clear-cut definition of second wave in our textbook style, but the second wave is every. If I explain it, that is every epidemic or pandemic, there is a rise of case now, slowly, and it will get a peak number of cases. Then, by its automatic nature, by its selection, that the virus gets loses its power, gets loses its virulence, and it decreases the total number of daily cases, active cases. And after that, the situation when comes is the people starts thinking of that the viruses are no more here. They are not at risk of having the disease, and the virus is also getting mutated every time, each and every day. And when a virulent strain comes first, wins the race, and as well as the environment for the virulent strain is okay for the transmission, then the second wave, the second increment of the cases, as a steep rise of the cases has been found, and it is actually the second wave. We are according to the epidemiology, and also we can say that the epidemics or the pandemics are not at all closed on the second wave or like that. They may have the third wave, may have fourth wave, but maybe a little. But second wave is more dangerous if we consider the history. If we consider the Spanish flu, SARS, etc., then second wave is always massive and always fatal from the first wave, if history says. And I'm just going to give some area of last week the tests and their positivity rate, so that you can have the idea test positivity rates. And after having this, there is a conception that if we having the test positivity rate in a higher side, we will be facing more number of cases and we will be having the peak very soon. And if we consider here, this Maharashtra is already getting this 23.44% of test positivity rate, and the situation is really alarming there. And also the Punjab, Chhattisgarh, Madhya Pradesh, you are also seeing this around 8% of the test positivity rate is around 8%. So it is very much alarming and very much problematic for the current scenario. So what is the reason of this second wave? So India's second wave deals, there is a blow to hopes of herd immunity. So herd immunity means a good number of people, a good number of countrymen, a good number of citizens when they have the immunity to fight against the virus. And if we consider in cases of COVID virus, that is we consider it 70 to 90%. Some people are saying that it is 70%. Some people are saying it is 90%. But we are giving a moderate amount, 70 to 90% of the whole people, whole country when gets the immunity by or either active way or in passive way like vaccination, then the herd immunity will develop, herd immunity will prevail. And why this scenario? Why there is a second wave? Why we are facing such kind of threat? That is, we are having mutant strain. I am going to show you the mutant strains of India, like UK variant found in around 807, and total number of 11,000 genome has been sequenced. Have been sequenced, and UK variant is 807, South African is 47, and Brazilian variant is 1. So this is the scenario. And there is no restrictions like right now. If we consider in India the whole, if we consider is 1 year from today's scenario from 1 year back. So 1 year back there was just lockdown has been called off, restrictions of containment zones and everything, the travel restrictions were there. So now we have no such kinds of restrictions in national scenario. So some states are implementing some kind of restrictions right now, but we have already experienced these states have already experienced the second wave. Those who are yet to have the second wave or second thrust, they are not taking any kind of measures. And if we consider, if you see our fellow citizens, they are very reluctant to comply with the COVID behavior. That COVID appropriate behavior is not maintained everywhere. And moreover, the elections, some the five states they are having elections, they are having the political gatherings, and also there is no restrictions on the gatherings like wedding, like in parties, everything. So this I have mentioned. So where is the ray of hope? I'll just say you some basic 2 to 3 points which makes us happier, which makes us confident that we can fight. We now the COVID can be defeated or can be. We should not be so much dreaded in condition. So the first one is if I consider this graph, uh, this shows you the recovery rate. India having the recovery rate right now is 94.2%. So it is very good. And if I consider the death rate and also the hospitalization rate and everything, so it is going down and down, and the recovery rate is coming up and up. You are seeing this unlock 1, unlock 2, unlock 3, 4, and 5, and after that March 30, the recovery rate is like somehow like 94.2%. And this figure shows you the taste. If I consider this similar period, similar number of cases, like today, this time we are having 50 to 60,000 cases per day, and we are getting this number of cases just in July first week to July third week, and we are getting the test there the March in February 15th to March 21, India conducted 7 lakh 90,000 92,261 daily tests on an average. And if I consider just a year before, that is, they are conducting 2,47,414 daily tests. So the test has been increases by almost 3 times. And we have vaccines. This is the most important point, most important features of us. Everyone of most of us are having some kind of questions: is it actually working, or why we are getting the vaccines? The vaccines have so much side effects like that. There are so many myths, and we are now going to clear you the some facts and everything. So I'm just giving you the brief of vaccination in COVID vaccination in India. If I consider the today's scenario from 16th January, it has started in vaccination as procedure has been started, and till now, total 6.3 crores of the people has been vaccinated. If I consider the total amount of Indian population, 140 crores, so there is not a one just 2% of the population. Uh, Almost 2% of the 2 to 3% of the population has been vaccinated yet, vaccinated on a single dose and everything. And the thing is, if we consider the whole amount of population is vaccinated, when we'll get the vaccine, we'll discuss further on that. And I just want to mention that India has taken a strategy to vaccinate the priority group first. The priority, first of all, the healthcare workers, the 1 crore healthcare workers throughout the country. Then the country tries to vaccinate the frontline workers like police, like your municipal workers, like our Jawans, the security forces, etc. And third phase was the common people, a segment of the common people where above 60 years of age, as well as the 45 years of above 45 years, but with having a comorbidity. But the government has called off the criteria of comorbidity right now from today onwards, the 1st April onwards. They are taking the criteria, and 45 years and above, every citizen can get the vaccines through the registrations and the vaccination sites. So in brief, I am going to take the pictures of vaccination all over the world. The first of all, the United States that have giving the maximum number of vaccine shots. China is second, and also India is not far from them. And 63.53 million already they have vaccinated. If I consider state-wise vaccination status, Maharashtra, Rajasthan, Gujarat, Uttar Pradesh, West Bengal are doing very well. But still, you can have the questions that Maharashtra is getting so much of vaccination. Still, they are having so much of cases. Where is the fault? Where is the point? So I have already mentioned you that there a kind of false satisfaction, false security among false belief among the recipients, so that after having vaccination, they just forget to have the COVID appropriate behavior, to follow the COVID appropriate behavior, and that's why they are taking the infections more and more. So today 31st March, till yesterday. So the first dose was 82 lakhs 47,000, and second dose is 52 lakhs. And the frontline workers, for the healthcare workers, this is the picture. We have targeted 1 crore of healthcare workers to be vaccinated, and almost 82% has been covered by first dose, and second dose almost 50% has been covered. And frontline workers, almost 91%. 91% of the frontline workers has been vaccinated, because they have also considered about 1 to 2 lakhs, 1 to 2 crores. And the 45 to 60 years with comorbidity, you have mentioned these figures. There's 3 crores first dose in the above 60 years. Sorry, 30 lakhs. Sorry, 30 lakhs. No, 3 course, I guess. Yeah, 3 course. So people fully vaccinated is people fully vaccinated is the number is 90 lakh 65,000. That is 6.67% of the total population. At least one dose, 4%, whichever already I have already mentioned about that. There's 4% of the population, 3 to 4% of the population has have been vaccinated. So we have what is vaccine? You everyone knows who are listening to this today. Which what is vaccine? Everyone you know. But what is the platform of vaccination or vaccine development and everything? We want to get some kind of ideas like that. So how the vaccine develops in our in whole world, in our India, everything. So there is a kind of DNA based vaccine. You know, the Sanofi is preparing on that. The RNA vaccines are there, the Pfizer, Moderna. They are mRNA sequence. They induce an mRNA sequence coded for a disease specific antigen like our COVID-19. And once this antigen is produced when it's in the body, it is recognized and triggers an immune response. Very simple. But this is a modern technology, comparatively modern technology, and we have very basic few vaccines and pneumovac, etc. They are using this kind of technology. And inactivated vaccines, they are very much old and every well tested. So they are taking the whole vaccines which has been killed by any chemicals or like that. And Sinovac is the example. And if you consider the other Indian vaccines like there is AstraZeneca vaccine, which is named as Covishield in India, which is a viral vector vaccine which inserts a gene for a viral protein into the another harmless virus. And this recombinant technology is used as a inducer of immune response. So the AstraZeneca Johnson is coming up with this. And India the another vaccine is coming up, that is Novavax. We are very much hopeful of that. So we are getting the phase 3 trial data of this vaccine, and this is a subunit vaccine. Introduce a fragment of the virus into the body, and then the responses come. And there is also live attenuated virus. No such viruses on this COVID virus has been tried right now. So in Indian scenario, we are having Covishield. This chimpanzee adenovirus is used. Is prepared by Serum Institute of Pune. Collaborator is AstraZeneca, and it is completed its phase 3 trial, and phase 3 trial is still going on because for having further post-marketing data. The Covaxin, we have also got this phase 3 data, or it is it is prepared by Bharat Biotech and in a collaboration with Indian Council of Medical Research, ICMR. The other vaccines which are in list, which are in line, which are in queue, this Jykov D, the Scadila Healthcare, they are trying to get it. They are in phase 2 trial. Very soon they are going to complete the phase 2 and going to enter in the phase 3. Sputnik V, you all know about this Russian virus. They are well tried in Russia, but their storage capacity is the storage temperature is not that suitable for India. So that's why it is not so easy to use this vaccine in India. And another one is NVX CoV 2373. This is protein subunit. Serum Institute of Pune, that is your Novavax, is under consideration. Its phase 3 trial is going on in India. And if I consider the two vaccines, that is Covishield and Covaxin, you all know you're having this kind of confusions that which is better, Covishield or Covaxin. I'm taking Covaxin and I'm having this kind of drug. What will happen? Sometimes of this the lactations are going on. I'm pregnant. This kind of questions from the patients are coming up with us. That what will you do? Should I take the vaccine or should not? Or you should wait for further. So like that. So I'm giving you the basic the Covishield and Covaxin. So now both the vaccines are in 10 dose vials, and their shelf life is 6 months, and almost similar, but the type of vaccine is different. I have already mentioned one is recombinant technology, another the whole virion inactivated virus. Another thing which was previously that dose is 0.5 ml each. but the duration, the gap between two doses was 4 weeks in the both the vaccine. But right now it has been increased to 6 to 8 weeks, and the various data in various countries and various papers, it has been found that after the 6 weeks, the immune response is better in case of Covishield. So in for the Covaxin, it's still 4 to 6 weeks. And there is a very term, very important term, very controversial issues like vaccine hesitancy are going on. We are giving, India is giving vaccines at free of cost till now, but still we are having a less number of people are getting vaccines in other in those 5 6 states, excepting those 5 6 states. There are so many states, they are not fulfilling their target that of vaccination. So I'm giving the some basic comment on the vaccine hesitancy and what are the causes. The speed, because the most important cause is the speed at which the vaccines were made. The use of new RNA technology has made some people nervous of getting the vaccine. The false message to social media, that is, some people, some kind of message are going on in the social media like that person is having this kind of vaccine, and after that he is getting that kind of disease, he is getting your cardiac ailments, he is getting some nerve paralysis and everything. Fear of side effects, yes, it is a most common issue in we are facing in every day, because I am running a vaccination center throughout the since the beginning. So I'm getting this kind of this after having the vaccine, should I get any kind of side effects, should I get any kind of adverse effects? This is the very most common questions. And the false sense of security that we don't need any kind of vaccine, the COVID is gone, COVID is nowhere is COVID. So this is that kind of false sense and false security or false hope, that is a very much favorable for vaccine hesitancy. And for that we need the data. And so we have the data of Covaxin, we have the data of Covishield already published. I'm giving the first page of the Covaxin data trial, and this is phase 3 result has been mentioned here, and it is giving an interim clinical efficacy of 81%, and it has been tried over 25,800 people, and it is including 2,433 over the age of 60 years and 4,500 with comorbidity. So it is safe. We can say it is very much safe, and it is also effective. That is, we are giving the 81% of efficacy rate. And Covishield is not that far or not uh, bad at all. Covishield is equally good. Covishield is you are getting this vaccine. This is 60 to 70% of uh, efficacy of this vaccine, and this is also very safe. The phase 2 trial has completely said it is very safe for human. And there is the vaccine facts I'm going to share with you, and even we are getting the questions, I'm just give you the brief idea on that. That which is, what is the contraindication? Contraindication is the persons with a history of severe anaphylactic reaction or previous dose of COVID-19 vaccine, he can omit the dose. Or immediate or delayed onset anaphylaxis or allergic reactions to vaccine or any injectable or the components in the vaccine. If we have any kind of allergies, any kind of anaphylaxis for which you are getting hospital admission or like that. But if you have a smaller kind of, say, a very mild kind of allergy like rashes, like throat irritation and etc., this is not at all a contraindication for the vaccine. And if I consider the pregnancy and lactation, for the according to Indian government, the pregnant and lactating women have not been a part of any COVID-19 vaccine trial, so so the data are lacking. So they should not receive the COVID-19 vaccine. But I'm giving you a data that the WHO says that lactating women can take the vaccine, and the pregnant should not, because they have not the exact data or a good amount of evidence. So I'm just giving you the message of having that already our moderator has mentioned everything, but still I'm going to give you the brief of getting the COVID-19 vaccine can protect you from getting sick. This is a basic. You have to understand it. If you get the vaccines, you will not sick, you will not get the hospitalized, but milder version can occur. Mild form of disease can occur, but not that severe, not the respiratory support and everything. This is almost sure for you. And getting vaccines for COVID-19 helps others in the community. This is called herd immunity. If you consider the pulse polio immunization in previous days, so in pulse polio we are almost giving emphasis on vaccination of each and every under 5 children. We are not giving, we are not leaving any children unvaccinated. So this is the target. So if we all are having the vaccines, then it will be good for our health. It is good for itself. And more vaccination for COVID-19 mean a chance to return to the normal, because if we are developing the herd immunity, and then the disease itself has lose its virulence, its power, its strength, and it will be a normal one. It will be very milder form. And though the COVID-19 vaccine development was fast, I have already mentioned that is fast, but does not skip the test steps. We have gone through the phase 2, phase 3 trials, and the trials are already going on, and the interim results will be published at regular intervals. So I think there will be no kind of confusion on there. And diversity in COVID-19 vaccine testing help assess safety and effectiveness. So this is the most important, that each vaccine is safe, I must say. And if we consider the efficacy, then efficacy and effectiveness, there is very similar to here, but this is different. But efficacy itself protects us. Efficacy means the protection of oneself, and if we consider effectiveness, it considers as a whole for the community. So effectiveness of the virus, we are expecting it very well, but we have to wait for more. But it is safe, it is for sure. So I'm going to give some plan of action. What is government now prioritizing? There again, this prioritizing test, track, and treat. This is tracking the people. The new positive cases should be isolated. Their contacts should be tested, and after that, they should be contained. The zone should be contained, and within a demarcated containment zone, containment zones, there is strict implementation of some things. There is essential activities can be allowed, no movement, no inside and outside movement like that. And you all are facing like that. And surveillance of ILI, that is uh, inf- uh, influenza-like illness, and severe acute respiratory illness. These two surveillance should be going on. Our ASHA Anganwadi worker, that is field level worker, they are getting some of these cases by door-to-door home visits. And if I get the good number of cases coming out, we have to make this area as a containment zone, and thus we can check the spread. And for the COVID-19 vaccination drive, there is advisory has been done to the everyone, that is to the every states. Only eligible beneficiaries are registered and vaccinated under category of healthcare worker and frontline worker. Archive this incorrect and duplicate entries. They should be archived. Identify pockets of low vaccination coverage, and government should give stress on that. Conduct regular reviews on private vaccination center in respect to their capacity utilization. If they are getting more and more number of vaccination going on in there, if they going to vaccinate more number of people day by day, then the government can give more number of vaccine doses to them. No sedimentation of vaccine stocks at any level of storage. Distribution based on consumption of avoid overstocking. We have to avoid the overstock. Regular review of the vaccine stock should be there, and vaccines wastage should be less than 1%. So we are getting this kind of situation where The 10 people are waiting for the vaccines, three are waiting for the Covaxin, and 7 are waiting for the Covishield. And we have to open a new vial for that. And if we open the new vial, we are the each vial contains a 10 doses. So you, after having the three vaccination, after giving the vaccination to the three people, the 7 dose will be wasted. So we have to take the decision. We have to counsel the patients so that so everyone can take one vaccine or like that, so that there will be no shortage or very minimal wastage of that, and timely utilization of the available stocks, so that before expiry date we can use all of them, and timely updating the data and everything, so it is according to the other portals and all. So thank you, and thanks to all the frontline warriors and also our healthcare workers who are giving their best through day and night. And we have to prepare for the coming days, because the days are not so easy. All the best to all of you.
Well, thank you so much, Dr. Anirban, for addressing these pressing issues around COVID-19. And I think you have also shared a lot of ground reality facts with us when it comes to the vaccination drive. And it is the need of the hour, and I'm sure a community of doctors will benefit from this session. We do have a few questions that we received from our viewers and some from the curious mind that work from our clinical team. So I hope you're up for some discussion.
Sure.
So, Dr. Anirban, I would like you rightly mentioned that we are currently in the second phase or the second surge of the COVID-19 in totality. What is your say over that when it was expected that we would have the herd immunity achieved during the first wave and we still couldn't?
It's a very related question. I have already mentioned on that thing situation. That is, now what is herd immunity? We have already mentioned that herd immunity is achieving the immunity of almost 70 to 90% of the whole population. If we consider the first wave and the number of people affected and everything, so that we are getting this, that a good number of people, that is around 30% of people are getting the disease through the milder form or in severe form, anything, but maybe asymptomatic. So after that, they are having the immunity, and this 30%, but this 30% is not that enough, not that good to have the total herd immunity to achieve. So we have to vaccinate, or we have to get the infection at least 70 to 80% people, so that they will have the immunity within them, and rest of the people, rest of this 20-30% people, they will get they will get the disease, they will cure, they will get treated and everything. So if I consider when we'll have the herd immunity, when we'll achieve the herd immunity, right now we have the vaccination procedure going on. So through vaccination, we can achieve the herd immunity right now. No other way, like active infection cannot be a solution of having herd immunity.
Thank you, Dr. Anirban. Also, I would like to ask you that there is this ongoing confusion and a query that we always come across is that whether the potency of the vaccine questioned due to the constantly mutating virus.
Yes, I have mentioned that. I have already shared you with the facts. Like there are some kind of vaccines they are preparing on that, and we have some kind of mutation. If we consider, actually, we are giving stress today on the Indian scenario, because the maximum people are Indian here who are listening to us. So in Indian scenario, we are getting the Brazil strain, UK strain, and South African strain. And if we consider the vaccines, we have Covaxin and Covishield. So Covishield is prepared from the virus vector virus technology, and it is going to modulate the mRNA, and after that we are having the immune response. So Covishield is also very much effective against the UK strain, which should be, because this vaccine covers the whole S protein and everything, and the surface protein. And the mutation in the Britain strain, we are getting this mutation in the S protein. There is component of S protein only. So we'll have the good amount of immunity. And Covaxin, I must say that Covaxin is better in case of mutant strain, because they are getting the whole inactivated virus or killed virus, and they are giving the immune response against the whole variant itself. So if we have any kind of mutation in any part of the virus, then it is expected that Covaxin will uh, fight against it. So if we consider the mutant strains and the vaccines, right now, except this Brazilian strain and UK, South African strain, some South African strain, these vaccines are quite safe, quite efficacious.
Okay, thank you, Dr. Anirban. So, as per contrary to our findings and the poll results that we showed earlier, where almost 98% of the doctors had received Covishield, so that the immunity that can be achieved against all the strains lies still with Covaxin. That is what I would like to sum up from the discussion that we've just had.
Yes, that because Covishield has been launched earlier. Then so we are getting the common people, the doctors are getting Covishields in priority basis. If we consider that whether Covishield is giving the immunity towards the mutant strains, yes or no. So I'm just say that whatever mutant strain is prevailing in right now in the country, like Amravati strain, like other genetic sequencing, after having other genetic sequencing, that is itself indigenous mutations. They are all they all will be protected by your Covishield. That is for sure.
Okay, sir. Thank you, Dr. Aramar. So, also, is there any clinically, as in, is it very evident the clinical presentation has also changed of patients with the mutated genes?
Yes. In our practical experience, I'm just giving you the practical experience and I'm giving you some data. So, in practical experience, we are having these new spikes, new cases when they are coming. They are complaining of more likely diarrhea, more likely body ache, like that. In previous days, we are getting sore throat, fever, etc. This cough, etc. This is main three domains, and we are getting right now more of diarrhea, fever with chills and rigors, some kind of with your anosmia, anorexia, etc. And also if you get the if we consider the data, we are getting this data from the other countries as well. So they are getting the new strain, they are having the symptoms are more wide or more not so precise. That is, if previously we are saying that there are four main symptoms like fever, cough, sore throat, and breathlessness. So now we are expanding this domain, expanding this symptomatology, and now the signs and symptoms are not so specific. At the last stage of previous spikes, previous wave, the last wave, we are getting uh, symptoms, these kinds of patients more frequently. But right now we are getting all kinds of symptoms. We are getting all kinds of patients with these signs and symptoms, and diarrhea is very much prevalent. Their body ache, fever with body ache is very much prevalent, and with the classical symptom of fever and everything.
Okay, so as per how you've discussed and explained it to us, I feel then there is a wide range of symptoms that people should ideally watch out for now with the newly mutating gene. So also, Dr. Anirban, what do you think based on also the CORAD scoring and the severity of lung infection? Has it also changed, or in the terms of scoring that we are now seeing in patients, is a bit more even in people with no comorbidities priorly?
Okay. The CORAD score and these things, CORAD score and the CT severity score, CT scan severity score. We are getting these kind of tests done to classify the COVID and to classify whether he is severe COVID or mild or like that. So this classification and the treatment modalities, they have not changed. They are still same, and we are getting, actually we are in where right now the health system is in quite better position. Why? Because we know the situation, we know the symptoms, we know the how to treat the patient, we know how to treat severe COVID with medications in hand. So the treatment guideline remains same till now, and we are having the new components, new kinds of spike, new kinds of patients, but treatment modalities will be the same as per as till date. We are saying so.
Okay, so I think Dr. Anirban, you've already answered my next question, wherein I also wanted to know, like last time when there was this emergence of COVID-19, Ministry of Health and Family Welfare had provided these detailed guidelines based on the severity score for the patient treatment. So now, as per your discussion, I think it will still remain the same for now, or are we
Yes.
expecting new guidelines as well
No,
from?
no. Right now, we are not expecting so much because we could talk to our colleagues on Maharashtra and in Delhi everywhere. So they are getting good amount of response by following the old the classical guideline and everything. So I think there will be chance of having no chance of getting that modification of these guidelines right now. if we are
Okay.
if we are if we are getting more kinds of symptoms, more neurological patients or cardiological patients, then we can add on that. But no, at all, no, we can modify it, but not at all we can change the whole guideline, because this guideline is well proved in all over the country as well as outside the country.
Okay, so the line of treatment, I think, will be more the patient to patient and case based, and the overall guideline will not change. Thank you, Dr. Anirban. And coming to the discussion around the vaccine and how we've also seen that there is a lot of hesitancy among the general public. Do you also feel that it is because of less guidelines and less information that is available for the general public about it, and the myths that always go around the vaccination?
I have mentioned about this vaccine hesitancy and what are the points. This is a mainly basically 4 points are there, and one is a lack of facts. You were also already mentioned about that. You have mentioned this lack of facts, but I've just shown everyone that the phase 3 trial of the both the vaccine have been published, and it is well accepted about safety and efficacy. So there is no doubt. There should not be any doubt on the efficacy and safety. And the people 1 month back they are asking that the Covaxin has no data, no data. So what will we have after having if we get any kind of adverse effect or like that? So right now they have no they should not have this question, but our government, our administrative part should percolate the message more widely, more precisely, so that people can get the original knowledge.
I think you're right there, Dr. Anirban, with the information segregation and COVID warriors and superheroes like you. I think the message can reach more positively to people, and that is what we are also aiming to do here. My last question for you would be again regarding the second wave. Till how long are we expecting it to last?
Yes, it's a very important question. How long this second wave will run? If I consider the 16th of July of 2020, we were having 50,000 cases, around 50,000 cases per day, and right now we are having 50,000 cases, around 50,000 cases right now per day in our country, and mostly shared by the Maharashtra state of Maharashtra. If I consider the maximum number of cases, that is the peak, that was happened in September, around mid of the September, 16th September, as per I remember. So 16th, from the mid of the July to the 16th September is at almost 2 months, almost exactly 2 months. So within 2 months, we have experienced the second wave, and there was a restrictions like travel restrictions. There was lockdown, not that strict, but simpler lockdown formulas. There are more people are more about more likely to get their go to get accustomed with the COVID behavior. They are doing the COVID appropriate behavior more precisely. But right now, these all scenarios, these all environments has been changed. We are getting right now no kinds of your COVID appropriate behavior in and around us, in your transport, public transport, or in your ways, in your roads and everywhere, in office, everywhere. And moreover to it, we have no restrictions, no nationwide restrictions on that. So we can achieve the second wave, peak of the second wave, which will be more steeper, more sharp, and more dangerous than the first wave. And we can expect it can happen less than 2 months, less than of 2 months of it. We can have it on a 1.5 month and everything. And I must also, and we must add that if the elections are going on in phasic manner in every state and in 5 million big states. So their condition will deteriorate further at any time if we're not aware of that. And one more thing I should mention, that if we consider India as a whole, then you should be definite that the second wave should not come to India, all the states all together. The various states will experience the second wave at various times. Right now, Maharashtra is getting the peak, and West Bengal, Odisha, they are not getting the peak. They are giving the minimal rise of the cases. After Maharashtra having the peak, it is evident that after Maharashtra having the peak, after that, maybe the eastern countries like West Bengal, Odisha, Chhattisgarh, Bihar, they are having the spikes of cases. So we'll definitely have the second wave. That is for sure, for epidemiological constant. It is epidemiological constant that we'll experience the second wave. But how we will fight with it, how we will fight against it, how do we check the spread, and how we behave with that situation, that is the most important. If we behave with the COVID appropriate behavior, if we restrict us with the COVID appropriate behavior, along with some government restrictions and the vaccination, the passive immunization, and this is the passive herd immunity, that can help us to achieve, or that can help us to lower down the spike, lower down the second wave, the uh, strength of the second wave, the vulnerability of the second wave, that can reduce some.
Well, Dr. Anirban, thank you for putting the troubled minds at ease by showing us the ray of hope. And I agree that COVID appropriate behavior is the primary concern currently that we are facing. And I thank you once again on behalf of Docplexus for your contributions as a warrior in white, and your contributions overall for the ministry as well as for the state of West Bengal have been truly commendable. And thank you for providing us the insights and the first-hand information about COVID-19.
Thank you so much. Thank you, Docplexus, and everyone who are watching. Is just my I last I want to percolate a one message lastly. So that is, use your the COVID appropriate behavior, and use your masks, sanitizers, and along with, take the vaccines whenever you get the chance of having vaccination. They don't delay it, because the days which is coming, in the future, is not so good for us. So be prepared for that, and be ready with all your arms, all your weapons in hand. Thank you.
Thank you, Dr. Anirban. Looks like 2021 is also going to be a struggle for us. And I would like to also conclude by thanking, on behalf of Docplexus team, all the frontline workers, our warriors in white, for their contributions and sacrifices during this pandemic. Be safe and keep Docplexing.
Thank you. Thank you.